We have Jason Carlton. He's a communications manager at Intermountain Healthcare. He built the social platform for Intermountain Healthcare's primary children's hospital, has worked in social across multiple hospital systems over the years. He's going to tell us the ways in which they went through a rebranding with digital first in mind and the ways in which people would discover them. So please welcome Jason Carlton.
All right, well, I'm excited for the opportunity to be up here and kind of share what we did at Intermountain. For those of you who are familiar with Intermountain, you'll understand that we have undergone a rebrand as a system. So we went from Intermountain Healthcare to Intermountain Health. So as part of that, that's not what I'm here to talk about today, is the big company-wide rebranding for Intermountain from Intermountain Healthcare to Intermountain Health. But more understanding what's in a name and the rebranding process that I went through for our heart and vascular service line for Intermountain Healthcare. That was Intermountain Healthcare at the time, and I've still got to get used to saying Intermountain Health. So I'm just waiting for my slides to come up and we can get started. But while they're setting that up, I did want to ask, a lot of you have probably seen that I'm the guy with the selfie stick camera and talk a little bit about the travel blog and stuff like that. So as we kick off, you know I'm a travel blogger, not associated with the Intermountain Health stuff, but I do enjoy that travel. So just a trivia question to see who can get it for a guide to the national parks in Utah that I've put together. So, but the question is San Diego related. So I'm kind of a space nerd. Carlton is my last name. Carltonaut, like astronaut Carltonaut, is my travel blog. So whoever can tell me which space capsule is on display at the San Diego Air and Space Museum, I'll give that guide to. So when you find it out, just shout it out. I do have an Instagram channel that has my Instagram, so Carltonaut, there's the answer on there if you want to find it there, or you can Google it. So just shout it out whenever you get to it, and we'll go back to that. So is it the Apollo? It is an Apollo. It is an Apollo, but first person to confidently shout out which one it is. It's not 11. It's not 7. There was no 23. Good try, though. It's not 13. It's not 12. It's not 7. It is Apollo 9. Who said Apollo 9? Perfect. Okay. Good job. So I'll make sure and get you the guide there. So, like all the numbers that we were whittling it down. So what's in a name? So looking then at a little bit things about me that I find interesting, and hopefully others do as well, to get to know me outside of the travel blog. These ones are work related. So I've taken a helicopter ride while hanging onto one of the skids. Our health system has Life Flight, which is the only civilian hoist rescue program, I think in the nation. It's one of the few, if not the only, and they had me do hoist rescue training. So that was a really neat experience to be part of that. I'm also internationally published, so I've been twice featured in the Journal of Digital and Social Media Marketing out of the UK. I'm glad they were out of the UK, so I can say I'm internationally published instead of just published. And then the other thing is, I'm not a surgeon, but I have played one on TV. So we did a liver transplant surgery TV commercial. They didn't tell me they needed the surgeon for it as I was lining stuff up, and so I got to stand in as the liver surgeon to take the pomegranate, aka liver, put it into the patient, and so I had my 5 seconds of fame in a TV thing. That picture and that line worked really well when I entered the dating scene again, and my wife saw that. Now my wife saw that picture, and I guess that at least sparked her to swipe right. So I guess she wasn't too disappointed that we, got married later. But so really what we're looking at, what's in a name? We're probably all familiar with the American Express name and the brand, and we see that, right? If you've got the credit card, you've got, whatever all those benefits are, you have that experience, that understanding of American Express. And I do want to stress that there's a difference between a brand, a name, and a logo. A lot of times people mix them all together like this is a brand. Well, the brand is more the experience with the organization. The logo is whatever typeface they go for it, and then the name is kind of how you associate it that way. So looking at what's in a name of American Express. So you're here, you're looking at that, but say that you're traveling internationally and you go over to France or Germany and you're exploring that and you see this, European Express. Are you going to be like, oh, okay, yeah, it's American Express, it's fine, or do you associate the name of, well, European Express is not American Express, or is it? Like, it's a little disjointed. Another example, Starbucks coffee, right? If you have that Starbucks coffee brand experience, or you see the sign as you're driving by or walking down the street, you'd be like, oh, I'm going to go and get a Starbucks coffee. Because you know the name Starbucks. Now, if you have the same look and feel, would you still walk into this place to get your coffee? Yes, perfect. But would you expect the same experience? The logo looks the same. I don't know what the brand experience is like, but it's a different name. So you're kind of wondering, am I getting the same treatment or not? So one of the challenges that we did with Intermountain, or that we had with Intermountain, is we were looking to rebrand our heart and vascular program. As we looked around the system, we had so many different names for the same thing. We have 33 different hospitals, and some of those have heart programs. So a list here, you've got McCady Cardiology North, not to be confused with McCady Cardiology South. Why you would go to North over South, depending on which clinic is there. You've got Heart Rhythm Specialist, the Intermountain Heart Institute, Southwest Cardiology, McCady Vascular and Vein, Bear River Cardiology Clinic, Intermountain Heart Institute Cardiology, different from Intermountain Heart Institute, Cedar City Heart Clinic. I mean, all of these are different names, but we're all one system, we're all one program. Why are there so many different names? It creates a lot of confusion for patients. And here's how that confusion starts. Park City over there, for those of you who went to this other, this conference, Park City, kind of east of Salt Lake, up the mountain. But say you've got somebody living in Logan that's about a 2-hour drive from Salt Lake, and they get told that they need to see a heart rhythm specialist. So they type in, Google search in Logan, heart rhythm specialist Intermountain. And the only thing that comes up is a hospital in Salt Lake City. Because on the Salt Lake City Intermountain Medical Center website, we use the term heart rhythm specialist clinic. That's the name of the clinic, that's where they're going. So they hop in their car, they schedule their appointment, and they drive 2 hours to get to the Intermountain Medical Center in Salt Lake City. Come to find out that in Logan, they have a heart rhythm specialist clinic. However, it's named the electrophysiology clinic. And so they just spent 2 hours each way when they could have gone maybe 15 minutes each way to the hospital, because our names are all over the place. So we needed to then unify our names both from the customer side to make sure that our customers could find the services they needed to that were closest to where they lived, and so that internally we felt we were all one system. We weren't 15 different clinics across all the different hospitals. So there were 2 different reasons we were looking to do this, so that we could really bring everybody together with the one goal. So the first part that we had to do was conduct an audit, and this is where I had to go to each hospital that I knew had heart services, Google them, browse the website, see what they came up with, wander some of the hospitals to see what the different names were for all of the different clinics that were there. And so this one here is a screen capture of the Excel spreadsheet I was putting together that has Southwest Cardiology, Cedar City Heart. These ones are all from Southern Utah. So I was looking at all the program names, but then I'm also looking at the clinic names, because clinics and programs and all of those differ. And then sometimes there were even other names that weren't quite a clinic, weren't quite a program. So really trying to put all of those together. And then this is one of our other hospitals in the Salt Lake City area. Again, all these different program names, all these different clinic names, and there's not a lot of synergy between any of them. They're all over the place. The program names you see there, a lot of them are Intermountain Heart Institute and something else, because one of our many facilities did undergo a rebranding years ago. Intermountain Medical Center formed the Intermountain Heart Institute. And so that's how they'd been operating. They'd been trying to build that brand. But at that time, all of our hospitals really were competing against all of our other hospitals. We had regions, and it's like if you go south of this, that hospital administrator would get really mad at the other hospital administrator saying, you can't market in my area. It's like, we're all one system. Like, why should it matter? We want to provide the care close to us. So Intermountain as a whole has been undergoing a shift to really look at how do we transition to that? How do we then make it so that it's consistent instead of disjointed? And so then everybody at Intermountain Medical Center is really passionate about this Intermountain Heart Institute brand, and they want to keep it. And then the other kind of squirrel caveat here is, what's an institute, right? What's a program? What's a clinic? What's a service line? You know, so as we're looking to rename it, we're trying to figure out what name is appropriate. I think technically speaking, an institute kind of operates in and of itself within a larger program. So Intermountain Medical Center, or Heart Institute, the Intermountain Heart Institute, was only institute by name. It didn't actually operate as an institute. Is that fair to the consumer? So a lot of different questions that we had as we looked at that. So this was just kind of the audit process. And then it's working with our organizational leaders to find out, okay, organizationally speaking, how are we organizing our physicians within these programs? So you have the electrophysiology, the general cardiology, interventional, surgery, thoracic surgery, heart failure, vascular surgery. So from a program standpoint, all of the physicians that we have at Intermountain fit in the heart space fit in one of these categories. So we knew, okay, so we have that. Now what we have to do is find the commonalities. How do we make sure that how the physicians are structured and organized fit into how the clinics are actually organized? So trying to figure out some sort of consistency across it as well was also looking at the brand. When somebody sees the logo, what are they going to see? And so we've got the Intermountain and then the program, Heart and Vascular. So it'd be Intermountain Heart and Vascular instead of Intermountain Healthcare Heart and Vascular. So kind of the Intermountain Heart and Vascular, and then the clinic name, so whatever that clinic name is down there, and then the location. And we were debating, okay, on the location, do we go the hospital that it's at, or do we go the city that it's in? Because we also have some hospitals that are like St. George Hospital, so you know that's in St. George, but then you have Intermountain Medical Center that doesn't have a location in there unless you call it the Costco Hospital, because we have a Costco right next to the hospital. So kind of looking at how do we name that. So we were leaning more towards naming it the hospital where it's located as opposed to the city where it's located. But then we found the consistency of we want everything to be listed as a clinic, because that's what people are looking for on the patient side. They're looking for, you know, I need to go to this clinic to see somebody instead of I need to go to this program or I need to go to this specialty, or you know, there's all these different things. We wanted to be consistent. So putting together the recommendations that we had on, okay, the adult congenital heart clinic, the heart failure clinic. We decided to go with heart rhythm clinic instead of electrophysiologist, because even I have a hard time spelling electrophysiologist. And so it was definitely above that, you know, grade level that you're trying to go for on them. But then you also have hospital departments that you only interact with if you're inpatient in the hospital. And so how do we need to take those into account? And so, you know, your cardiac procedure unit or the EKG lab or genetic counseling, we had to try to figure out how do we want to really take those into account as well. So that's a lot of data. That's a lot of like researching and trying to figure out, okay, where are the commonalities? What do we want to do? And how do we want to make it more friendly for the consumer? We also then have to work on renaming everything. What are all the things that we need to rename? We need to do clinic signage, brochures, billboards, provider videos. I highlight websites. I'm going to talk a little bit about that next. The letterhead, the bills that patients receive, the phone trees when people call, directional signs, swag items. I mean, there's a lot of different things that we have to go through and transition over to whatever this new name is, but also there's a rebranding element to this of what do we want our culture across the system to be. Now that we've kind of all come under one name, what do we want our brand to be? What's our brand promise to our consumers? What's the reason behind why we're rebranding this program? And of course, the list goes on and on. There's a bazillion things that you have to go in and rename or rebrand as you're getting into that. One of them that I want to talk about is structuring the website. So I already kind of gave that problem that a patient would find where they're searching for heart rhythm specialist and driving 2 hours each way, whereas they have something at their actual facility nearby that can save them a lot of time. So making it consistent and patient-friendly. And so we had to develop a sitemap, trying to identify what's going to make it the most usable for people who are using the website. So we have our home page. We have the different areas. So we're going to have our specialties, our conditions and treatments, the locations where everything's offered, who the doctors are in those given specialties, and then we do a lot of research and have clinical trials we're involved in, so we wanted to be sure we had that element as well. So taking all of those clinics that I had listed off earlier, we put that under specialties. So you'd have your structural heart clinic, your thoracic surgery clinic, your cardiovascular surgery clinic, your vascular and vein clinic. And then under each one of those, you'd have an overview of what the program is, why choose Intermountain. We wanted to make sure that that was in each and every page that we had is why choose Intermountain. Maybe our mortality rates are lower. Maybe our readmission rates, 30-day readmission rates are lower. Whatever those kind of key metrics are that a patient or even a referring physician would be looking for, we wanted to make sure that we had that information on the page. Also, what conditions do we treat? We wanted to make sure that they understood that, oh, I have atrial fibrillation. You might have a heart rhythm clinic, but do you actually treat atrial fibrillation? And getting into that. So, and then the appointments with specifically how to schedule an appointment. And then, of course, the location. So if you think about it, if I'm a patient and I'm looking for a heart rhythm specialist, and I Google it, and I come across the heart rhythm specialty page, right? I'm able to go in and read, okay, yeah, it looks like they do cover, okay, I want to book an appointment, let me click there, it takes you over to the location. Okay, this clinic is offered at these 5 hospitals, this is the one that's closest to me, I'm going to go ahead and go with that clinic or that hospital. So it really helps the person find the care that they want in the location that's most convenient for them. And having that very consistent structure and name will help that. So we think, okay, we've got all of that done. We're ready to go, right? A big sigh of relief. We're ready to actually hit the button to change everything. But maybe you noticed that we're not Intermountain Healthcare anymore. We're Intermountain Health. So just as we were getting there, and this has been a multi-year process of putting all of this research together, doing the audit, going with recommendations, they say, you know what, we're actually merging with another company and we're going to go through a whole rebrand, so you need to pause. And so we've been sitting on this for a year and a half now, because they wanted to, as a system, rebrand Intermountain Health. And as they've done that, and we've started sharing the work that I did in the heart and vascular space with the brand team, they would be like, oh, this is perfect. Okay, we're going to take that and we're going to do the same thing for all of our other service lines so that we can be consistent. So the work hasn't gone in vain. It is being used in other programs very slowly because the integration and the rebrand is a very, very long process. But that's really why it's paused right now, and it's so frustrating for our programs because we've been talking about rebranding for 5 years now, and just as we're almost there, we were trying to hurry and rush it too before we knew the rebrand, so we were at least there. But we also knew the company that we were merging with, they were using heart and vascular instead of cardiology clinic, or cardiology program or services. So we're like, oh, well, we're going to be ahead of the game if that's what they've been going with. We like it. It's kind of where we were leaning anyway, but that just makes it more consistent. So just all of that research has been really important as we've done that. And just kind of the headline of now 33 hospitals, 385 clinics across 6 states. So here's the map that now for heart and vascular, I have to try and figure out how are we consistent in all of these different states in the heart and vascular space. Now, the good part about kind of the merging as well is all of this work that I've done has given me a really great understanding of what heart and vascular is like for Intermountain. But we now have a brand team that is going to take this work and run with it, and it's no longer something that I have to mess with, which is good because it's kind of a mess trying to figure it all out and be consistent. But I'll be involved from that standpoint. But I mean, you look at all the different clinics and hospitals and air bases that we have, it's a lot. But I'm glad to know that the work that we did, that audit, that looking for consistencies, that making that recommendation, with the focus on how is it going to be easier for the patients who are trying to find care close to them. So they're not bypassing 3 hospitals to get to the one that happened to be the Google search that they were looking for. And then the other side, of course, is that internal audience, making sure that we are one team all working together on it. So kind of that, deer in the headlights of at least it's being used, we can get excited about it, and we can really look forward to, more time to make it what our patients need. So with that, I'll open it up for any questions.
Questions?
I had a question.
Yeah.
I was going to say, if you got, it didn't happen, but if you did get to execute this, if you would have any pushback about changing all the names on all the buildings. I was thinking about the logistics of that, how complicated that would be, and then how patients will then be like, oh, so now I'm going, instead of Intermountain cardiology, I'm going to health and vascular. Like that would have been interesting to see, but.
Yeah, it definitely would have been a difference for the patients who had been consistently going to those clinics and now some of the names had changed.
Yeah.
And I think that just comes with educating the patients as they're coming, as they're scheduling those appointments, because the locations hadn't changed, just the names of them had changed. I think the one that we were getting the biggest pushback on was the Intermountain Heart Institute brand at one of our hospitals, because they had rebranded 10 years ago to Intermountain Heart Institute, and they were very passionate about that brand. And so now to come in and say, you know what, as much as you like that brand, it's not going to be that anymore. And then other regions started taking on that brand as well. So Intermountain Heart Institute, Utah Valley Hospital. So that Heart Institute brand started going out there, and now we're going to come back and say, no, now we need to kind of rein that in and be consistent. And as new clinics are stood up, we make sure that whatever clinic name they have, it's consistent with all this other work that we've done.
Jason, what patient input did you get, and were there any surprises or key learnings from the patient side about how they identify and relate to some of these, I think for many patients, sort of arcane naming structures?
Mm-hmm. So we didn't have any focus groups or anything that way with patients specifically, but we did talk with a lot of our stakeholders in those clinics as they were looking at, what feedback are they getting from patients, and also looking at where patients were traveling from for care, talking with referring providers on what they're looking for as they refer patients in, and then talking with the leadership of our clinical program as they're talking with other health systems that are doing similar things. That's kind of where the feedback came. But we did not have actual patient focus groups and get direct patient feedback on it. So I guess there's some assumptions there of what it is.
And what are some of the key challenges that you're facing on the search side, and the ways in which people are searching for services that you need to overcome, and the roles that the branding and the nomenclature play in how people are actually discovering you in searches, and what you know about how people are conducting searches?
Yeah. So we have a whole team dedicated to digital, Google searches and Google ads and coordinating a lot of that. And that's an area that I haven't gotten into much myself. I am starting to kind of look at, okay, how are Google ads? How can we, tie those Google ads into the work that we're doing? But before you can really do a Google ad, you need to have a good landing page for them to go to. And right now, our website's a mess. I would not try to recommend somebody going to this cardiology clinic webpage because I know that's not going to be what they're looking for. I know it's all, we are this, we are this, we are great, we're great. And then here's all this like medical dump of information from Walters Kluwer, I think is who we have some of the medical information, or at least we're working to get some of that embedded in. So I think before we can really go into the digital space and really up that, we've got to look at that website structure and get something in place that works for the patient and that allows us to market them to a site where they can get the information they need of why should I go there and how do I schedule an appointment.
Jason Carlton, thank you so much.
Yep. I think there was a question right there.
Oh, I'm sorry.
Yeah.
I'm sorry.
No worries.
Go ahead.
Hi, this is Maggie from Butler Till. Were you brought on specifically to attack this issue, or did you come in and you're like, wait a second, something needs to change here?
So I've been marketing the heart and vascular space for several years, and this is something that just kind of keeps popping up. So I wasn't brought in specifically for the rebrand. It's just one of those, one more thing that they add to your plate that you need to try to do, which I'm sure we all experience that of like, oh, we should do this. And so I mean, I was in countless meetings trying to move it forward, trying to get the right players from our marketing team involved, and it wasn't going quite as we would have hoped it would go. But yeah, that's kind of how I transitioned into trying to do this beyond all the other projects that I have. So,
Jason, thanks so much.